At this point, pembrolizumab is well established in the management of non-small cell lung cancer, but that really originated as part of the Keynote-001 study. This was a large phase 1 study, actually led to the initial approval of pembrolizumab in melanoma, non-small cell lung cancer, and the companion diagnostic assay. And this is not the first presentation from that data set, but in some respects, it is the validation of all of the data that has come so far in that really the promise of immunotherapy has been that you would be able to induce durable responses amongst patients, that you would have patients really surviving for long periods of time, doing well. And what we show as part of this data set is that among all comers, over 15% of the previously treated and over 20% of the treatment naive patients were alive at 5 years. The median follow-up at this point is over 5 years. There were 101 treatment-naive patients and 449 patients who had not received prior therapy. One other thing that has been consistent throughout the Keynote-001 study and really throughout the pembrolizumab clinical trials in non-small cell lung cancer in general is that patients with high PD-L1 expression have had clearly superior outcomes as compared to patients who did not have high PD-L1 expression, high expression being PD-L1 in at least half of their cells. What we showed as part of this was that patients who had PD-L1 of at least 50%, at least a quarter of them in both groups, the treatment naive and the previously treated, were alive at 5 years. In addition, there really was not a clear increase in toxicity between years 3 and 5. We have periodically updated it, and the toxicity at 5 years was very similar to what was seen at 3 years. So in terms of the implications, I think we really have changed what the outcome is in some level, we as a lung cancer community, for patients with advanced non-small cell lung cancer. I think that whereas when we started this study we would have anticipated 5-year survival in the low to mid single digits, I think that we can now say that we can anticipate that 15% of our advanced non-small cell lung cancer patients will be alive at 5 years, and probably up to a quarter, if not more, of the patients who have high expression for PD-L1.